While we're waiting, just to add on to what Dr. Markowitz said, it's our job to get the word out there. Since the study came out that showed that screening really helped improve survival, only 4% of the patients who were eligible for screening in the United States actually get screened. So we're missing 96% of the population that are potentially curable because we're just not getting the word out. So that's a very important point.
Yeah, and I think that one of the new populations that I want to talk about is people in what I've called high-risk communities. And asbestos disease, there have been a number of waves. The first wave was in miners and people who extracted and milled asbestos, and that was mostly occupational. And then, as it was used in industry, asbestos cement products were made, other uses in industry, insulation, again, the workers who worked there. But the third wave that we're experiencing more now, especially where we've banned asbestos, let the ban come on, is from asbestos in place. The asbestos we spread around is now raising its toll. And that includes high-risk communities and also the new scourge we're recognizing of natural asbestos. And we've known about some of these communities for some time. Libby, Montana, Wittenoom, Western Australia, Karain in Turkey, Casale Monferrato and others in Italy, others worldwide. But I want to take us to one very close by here, about 100 miles away, which is Ambler, Pennsylvania, which we've been studying. And it's in suburban Philadelphia, 18 miles from the city. And in 1897, as a result of a laboratory accident, Dr. Madison discovered that milk of magnesia, combined with asbestos made a wonderful insulating product. And he started to make pipe coverings, asphalt for roofs. It took off. And by 1910, from 1910 to 1920, it was the world's largest producer of asbestos products. They called it the best in asbestos. It was a factory town. Little houses for the workers right next to the plant, many of them still there. Big houses, bigger houses for the supervisors, mansions for the executives, and a castle for the owner, complete with its lake. And imported to that to work with the asbestos were Italian Americans and African Americans. The Italian Americans came from just south of Naples mostly, the African Americans from counties in Virginia. And they worked, it was a wonderful town, one of the first places to have electric lights. But then the asbestos accumulated as the town got better. And in the 1970s, with environmental and occupational legislation, it had to close. There was no way it could meet, in my opinion, the new standards. There was urban decay, and now there's a renaissance. People are returning, the schools are good, people are buying up properties. It's a family-friendly community with excellent restaurants. And here's a family photo from the 1960s. The happy kids and some of the asbestos waste. And here's another photograph of the asbestos waste. Here it's been fenced off in the 1980s. You can see the swing, you can see the asbestos pile. The grooves in the pile are made by kids opening up cardboard boxes and sledding down what they call the White Mountains of Ambler. There are no mountains in Ambler, it's flat, but there was enough asbestos-containing waste. And the fence, and I'll return to this, the fence in the histories we've been taking from the community, the fence is not a solution to asbestos. Particularly kids got through the fence On YouTube, we can see instructions, how to get through the fence, how to put it back so no one will know you've been in there. And we have stories of people, kids made caves in there. In some other communities, they use power motorbikes riding around. We haven't seen that in Ambler, but a lot of other exposures. And particularly the exposures how were people exposed? Particularly the adolescents seem to be at risk. Here's another something from YouTube, and this is in the old asbestos factory, a paintball fight. It's terrific because the red paint or whatever other paint really shows up against the white of asbestos. And that's on YouTube. Nobody knew unless you went to YouTube. The legacy of this is a legacy of mesothelioma, and we can't find, as in many communities, whether there's increased lung cancer for the reasons that Dick Lemon and Art Frank and others have discussed. But the mesothelioma, almost 3 times the increase against Pennsylvania, high mesothelioma state in women, and a higher relative risk. The rate is higher, not the number of cases, but the rate is high in women. And nothing in the neighbouring areas. So what are we doing about the legacy? There were 2 areas of big contaminated waste. The first, about 24 acres, was declared an EPA Superfund site in 1984. And it was worked on, capped, slopes were graded, seeded, fenced with signs, as I said, useless, and they dismantled the playground. But the problem is when people look at that, and if I was to take you there today, you would see some old white asbestos cement pipes lying around. You'd see them by the creek. You'd see where trees that had grown there had fallen over. And despite the capping, when they fell over, the roots would bring up asbestos to the surface. We'd see the burrows where animals, groundhogs, have burrowed in. It's really not a very satisfactory solution. By chance, or for reasons that are obscure, there must be reasons, but we don't. Barry Castleman hasn't been there to find them yet. The part of it was not put in the Superfund site in 1984, and that is currently being worked on. In fact, it's about completed the first stage of making this safe. And here's a picture of the area, and you can see a pond, which is the old reservoir from the factory, being made into a bird sanctuary and an area that's a park. And this is the sort of work that EPA did. You can see the asbestos cement residues there, and you can see the covering slowly coming down to cover them. Well, there are some issues. This, I think, is the new face of asbestos. And this will not, the asbestos use needs to be banned. But that is not going to take care of this sort of asbestos that's already in place. So I want just to talk about some of the features of towns like this, because this is our emerging problem. There are diverse ways we're exposed. People who work there, people who lived with workers, people who are just exposed to the air in the area, and the lifestyle and behavioural things, the kids playing there, all those sort of things still expose people. And we must remember that 20% of people who die from mesothelioma have no history of being exposed to asbestos. But when their lungs are examined carefully, there's a very good study recent study from Australia, 95% of those people have huge numbers of fibres. They have the asbestos exposure, they just don't remember and they can't tell us, and we don't have good enough questions to get from them where they were exposed. And there are vulnerable groups in these communities, the environmental justice communities. The people who live around this site are particularly the African American people and some remaining Italian American people, and they are really much more exposed, the people close by, than others. We have to make sure they're aware and they get the prevention. We have the behavioural vulnerabilities, especially adolescents, home renovators, gardeners. Do they know about the hazards? Do they know what to do about them? We have in Ambler a lot of flooding, and that flooding mobilises asbestos, and that's true of most communities. Cyclones, hurricanes, floods, very dry periods, they increase the hazards, and there may be some genetic and familial variations. All of these communities that I've been able to find so far, there is a higher proportion of women. That's characteristic of community exposures. Dick Lemon referred to that. And a slightly younger age distribution. And why that is the young are not more vulnerable. But if you're exposed at the age of 1 or 2, or you're a worker and start exposure at 20, your risk period will then lead to mesotheliomas at the age 30, 40, 50, rather than 60, 70, 80. And that's the new reality. There's a big problem with environmental exposures and community exposures as to who's responsible. It's very clear occupationally. The Occupational Safety and Health Act, the employer's responsible. In Ambler, it's a mess. There's the US EPA, there's the state EPA. 3 different municipalities have part of the one site. They don't all agree on what to do. They've got different attitudes to risk, extreme in the fact of two of the communities. One doesn't care at all, would like it just to be nothing ever said about it. They think it affects land values. We've looked at the data and talked to the real estate agents. It doesn't affect land values, at least in Ambler. And the other one is very keen to remediate and have a sustainable solution. With all these people who are involved, and I've put a list on the slide, there are many. One of the great issues is the diverse attitudes to risk. We've done in-depth interviews with people, all walks of life. What do they think about asbestos? And there are extreme views on risk. Some people know any one fibre could kill you. They're very aware of the risk, maybe hypersensitive to it. At the other end are people who really don't care about the risk. They don't think there's anything about it. And yet, all of those people can name someone that they know that died as a result of asbestos. It's not a matter, the perception of risk is not a matter of just knowing about the hazard. And a lot of the government programs, I think, say, we're going to make people literate, tell them about hazards. It's deeper than that. And even people in the same family can have a totally different perception of risk. And we're doing some work to look at that. But one of the what do we do to solve the problem, get people to talk about things and to understand each other's point of view? What's very important that we believe are stories. And we have a program now to give stories to people in high schools and elsewhere about asbestos. And one thing that's been very successful, we had a series of plays that different people came to, one-act plays about Ambler, what happens, different perspectives from the people we'd interviewed. And people came away from saying that, you know, now I understand where those people are coming from. But that's a major issue with environmental exposure. We've got to To get people on the same page to get a solution, they've got to have some similar attitudes. The others referred to this. We've also got to expand the definition of asbestos. The erionite, the Libby-amphibole asbestos, they're asbestos. They're just not regulated as such, and they're just as fatal. We've got to help high exposure communities make available the medical surveillance we've talked about and give some social and psychological support to help people in those communities. And registries of exposure would help. And in the end, and this is an artist's conception we're working, we've got to find a way to make those areas, 65 acres in the middle of Ambler, make it not useless land, not fenced off, which doesn't work, but somehow under the ground or out of there in a way that we do not have exposure in the future. And these communities, we're finding more of them, they're all around it, and it's a different issue to the old issue of occupation exposure. Thank you.